My Doctor, your health anytime, anywhere. Hello, lovely people. Welcome to the My Doctor podcast, where we discuss various topics of public health concern. We just want to engage the community on these health issues, and also to bridge the gap between the doctor, the patient, the caretaker, everyone. We just want to be able to learn more about certain health issues. So last week we had an episode on non-communicable diseases with Dr. Nathan, and wow, it was so awesome. If you've not watched it, please go back and watch it, and you will learn how your lifestyle can influence various health issues and how you can prevent all that. So for this week, I am back again with Dr. Nathan, and we're still going to be discussing an issue that is of a public health burden, in other words, yeah? And that is HIV care. So according to the Sustainable Development Goals, one of our goal was to have a world that's free of HIV by 2030. But have we been able to achieve that? So we're going to talk about that in this episode, talk about things like self-testing and self-diagnosing, and if someone already has it, what are some of the things that they could do to improve their life and everything. Yes. So my name is Mwesigwa Joy, and I am going to be your host for this show. This is a My Doctor podcast. So yeah, you're welcome, Dr. Nathan.
Thank you very much.
How are you?
I'm good.
You're good.
How are you doing?
I'm fine. Yeah. So our topic today is basically HIV care. Yes. And so I would want us to start at a point of, there's a saying of prevention is better than cure, really. So I'd want us to start from a point of prevention, yeah? How can someone out there prevent themselves from getting HIV, in simple terms?
Well, HIV prevention is, it starts with you. It starts with me. And I'm very glad that the Ministry of Health and the country, as Uganda at large, as a nation, they have been able to support the community to understand exactly what HIV is and how HIV can be controlled or prevented. I thank the government because they have tried to avail antiviral drugs to every facility, at least up to the level of that is medical center 2 or health center 2, where you can access the treatment for HIV and testing. At the same point, many people have known. I may say it is good for people that have known that HIV kills, but it is preventable and it can be controlled. Now they have taken it as for granted. They say, even if I get HIV, it will be controlled. It will be treated. That is the challenge that we are facing at this point, because there was stigma that when you get HIV, it has no medicine, you have to die and all that. The government had to bring in counselors, they have to bring in more implementing partners who came in and they started teaching us exactly what we can do. And they have known. People have known the prevention, including use of condom. They have known things like testing your partner before sleeping with him or her. They have brought things like this abstinence. Someone says, no, if I'm to have HIV, let me be with my husband at home. Even if the husband goes out, the husband will check himself. So they have known that this is what is there. And at the same time, they have known that no, after having men being circumcised, we have had IDI people circumcising men from 15 years up to 49 years, trying to prevent HIV. And people have taken it now to be as their chance now of moving up and down. That's why it may be hard for us to sustain the development goals, whereby you have to control this, because even young people are practicing unsafe and unprotected sex, because they say, even if I get HIV, I will get medication. They fear pregnancies than now HIV. So the government needs to do a lot to sensitize the community against the dangers of this. Yeah, but prevention measures, they are there. And among the prevention measures, we have seen the circumcision programs. And as my doctor, we were trying to look at how we can get support to have circumcision program run into our projects, because it is very important, especially these sexually active partners, these young adolescents from 15. Now they have moved it under IDI up to 12 years. That from 12 years up to 49 years, these people can be circumcised, and they will be at a low risk of transmitting HIV, because in most cases, these HIV disease itself, it just wants a weak penetration, where you have some bruises, some chronic UTIs, then you find when you have got HIV. But with a circumcised man, it is a bit reduced. So another thing is to use condom. We have condom everywhere, condom use, female condom, male condoms, in health center tools, health center 1, even community health groups, those VHTs, the voluntary health teams, they are there with condoms, they supply. But again, the worry is their storage. How do they store those condoms? How do they use them? Do they first educate these people before using them? Or they think they know, they only just distribute them? So there is again a risk on those people whom they are just distributing. The other thing is abstaining. There are few who abstain and be faithful to their patterns. But as I said, they no longer fear now HIV. They fear being pregnanted than getting HIV. So those are some of the cases that we encounter with, especially in the community.
Okay. So there's something you talked about that's really common. People testing each other before having sex. And so I think long ago, like they would go to the hospital and everything. But these days we have these kits that are sold at pharmacies where you just buy like a kit and they're really cheap actually. And then you like either swab or pierce yourself, just self-testing and self-diagnosing by the people out there. So how accurate are those kits? Do they give us the clear picture of this person's status?
Yeah, well, I think the challenge will come now into the implementing patterns of those places, like the implementing pattern of IDI. We can talk of Married May, we can talk of any other implementing pattern. Or how do they sensitize the community before supplying those oral chicks or these self-testing kits? Do they take time to identify the group and they say, let us educate the community about how to use this? They only supply, and you find they have educated maybe the DHO, they have educated the councillors, they have educated maybe people at the municipal councils. Now, those are not the people who are going to test. They are the people who are going to supply. Now, when they come and they just demonstrate, they will not know that you should do HIV testing maybe early in the morning before testing food, maybe before taking tea, maybe in a certain period of time. Now, these people, they only pick those self-testing kits and they keep them in their bags. You find a taxi driver have 3 packs and is putting it in the engine of the car because he doesn't want the wife to know that he has them. Now, after 2 weeks, the same test kits are being kept in an engine of the car. They are the ones being tested. One, the temperature have killed them. They are no longer working, and on the time of working, you find they are giving you invalid results. Now, I think it is very important to have a health education talk, general community awareness about the self-testing kits before supplying them to us. Me, I may know how to use it because I'm a medical personnel. But how about the person I'm going to use it on who does not know how it works? If I'm HIV positive and I have admired a girl whom I want, I will take my fake test and I try to say that I'm testing myself and I'm testing her. And in the response, I have transmitted the HIV into her. because she doesn't know how to use it. She doesn't know how it is. So what am I saying here? That whether self-testing, whether non-piercing, they should be all tested in the hospital, not by individuals.
Not by individuals. Okay, so this, you've talked about the swabbing, yeah? So that brought me to think, if someone has eaten, can they get a false positive? And
Yeah, that's what I was trying to let you know, that there are factors affecting them, the testing, those self-testing kits. There are very many factors. One is heat, the conducive environment, the temperature that you have kept this kit in. Second, the food that you have taken. Because what we are looking at the saliva and the membranes within your mouth. But when you have taken food, sometimes you swap out food. You swap porridge. It's what you are testing. What will the porridge give you now? It will give you negative, because what you have swabbed is a wrong sample. That's why I'm saying there is a need for them to sensitize the community, or they entrust the communities with the hospitals which are on ground, the community hospitals, the village hospitals. They entrust with them. They give them kits, give them support to have this. Then they connect with chairman LC1s and councillors. We have them in the markets and churches or wherever. They first understand how to do this testing. And secondly, we have this whereby you find someone has been on medication, HIV drugs, for more than 10 years. And you do the checkup and it is negative. But someone frankly would tell you, but me, I'm HIV positive. What picture do you get from there? That these kits, there are some people they work on, and those ones they don't work on. Especially when you do viral load of someone who has been on medication. It has been not detected, not 1 year, not 2, not 3, but for 20 years. But someone is still adhering on treatment and is taking drugs. But you are testing with oral check or any self-testing method, and they are telling you they are negative. What are the government or what is the ministry selling to the community? It means we are implementing now more HIV into people, because people are getting infected in a wrong way. They are not aware. These are the people who will say that I got HIV through my mom. Maybe they have bewitched me with HIV. Because someone will say, I tested the man I slept with 2 months ago. How comes that today I'm positive? You see. So it's all about the myth people have, the misunderstanding between the Ministry of Health and the communities. And maybe it may be funding, it may be weakness of the Ministry of Health to implement this, or the weakness of implementing partners. Because when you look at the Ministry of Health, they may not come down up to the grassroots, but they have the implementing partners. If you find you have HIPS Uganda, then from there you have USAID. From USAID you have now these other ones, Mardme has another TASO has another CDC. All those people, I think if it is our wish as my doctor and me as a person, and you, of course, I know you support me, we should have exactly more knowledge about self-testing and prevention better than other than cure medicine, because it is costing a lot of money in sustaining the people of HIV, people living with HIV, than testing them. When you look at the drugs, the manufacture of the medicine that someone is going to take for 3 months or 1 month is more expensive than a team to come on ground and sensitize people on how to use these testing kits, and they use it, they keep that knowledge forever, than giving this person medicine for life. You find 1 tin is a lot of money, but testing kit is simple, a cheap test. And the information they are going to get is going to be there for life, for all of their life.
Okay, so there's this belief that our community has that undetectable is equal to untransmittable. I don't know if you've heard of it. Like, some people believe that if someone is undetectable, they are not able to transmit. the HIV, the virus. So I just want you to comment briefly on that, because someone could be out there and they're like, the person is undetectable. I will not get HIV. Yeah.
Well, when you look at most of those cases, we have them. We have people who are living with HIV and they have their partners whom they have come with and they are HIV negative and they are ready to be with them. However much you explain to them, they say, no, me, I love my partner and I want to be with her. But you say she's HIV positive. Say, no, but she's on treatment. If she's on treatment, I'm negative, I'll be with her and want to have children. And that's why we have PrEP and PEP. The PrEP medicine is given to them, and because it is their choice. But there is no guarantee that this person is not going to get HIV. Though HIV is non-detectable on doing the viral load. The viral load means you are trying to check the use, the work of this medicine within the body of someone is taking. You understand? Now, you want to see, is this medicine working on the virus? Or this medicine is not working on the virus. If you want to test that, know that this person can transmit HIV, you just withdraw the medicine for 1 month. This person is not taking medicine for 1 month. And you will find the disease has come back. When you do viral load, it will be detected. So that means that the HIV thing, a virus, lives in the cell. It goes and lives in the cell, and DNA, it attaches to it to the DNA.
It's a myth.
Yeah.
Okay. To our public, hope you have heard that. Undetectable is not equal to untransmittable. So be safe out there. So you talked about the discordant couples in your conversation. One is negative, one is positive. So in a scenario where you've received patients and they're like, we are going to stay together. I know he's positive. So I would want you to paint a picture for the public, like for the negative person. What are the things that they should expect if they decide to stay with this person? Like in terms of the PrEP that you've talked about, do they take it for a lifetime too? Or they take once a month? Like, I just want someone out there who wants to make that decision to be able to know what they're up.
Well, it's all about the protection. And these people, when you find they are discordant, we continue to do other tests. There are those who are discordant and they transmit HIV. Someone is negative, you do all the tests and this person is negative. But when he sleeps with another negative person, you find this negative person have changed into positive, but the other discordant is still negative. Yes, those are few and rare cases, but they are there. Then we have these discordant couples whereby someone is negative and has never contracted HIV. Then he says, I want to live with my wife. I want to live with my husband. We have to advise them on hygiene, continue hygiene. That's number one. Number two, avoid those herbs to base down. You see, women have a tendency of looking for other extra fruits, the okras, the rests. They know them. There are very many. Now, when they use them, they attract more microorganisms down there. You find when they have got other diseases and have got eruptions, skin eruptions down there, and it can easily transmit HIV. Then we advise the husbands to use condom. If they are not rushing to have children, then we tell them to use condom. If they have not used condom, then in the time frame of looking for the child, this husband is going to use PrEP for only 6 months. And after 6 months, knowing that this person have conceived, my wife has conceived, then I can go back to my use of condom, so that you keep protecting yourself, not to give all your heart and your body to get HIV. Yes.
Okay. That's a really good picture of the situation. So let me take you to the hospital. So we advise couples to test before getting married, or if someone just wants to test, how many times should they test? Like, is one test enough? Like, I've come to the hospital, I have tested today, I'm negative. is that enough? Like maybe as a couple, is that enough? Or we should come back after 3 months or yeah, something like that.
Yeah, we give all couple testing, we give them 3 months. Why? Because it is when the disease can be transmitted. The maturity of this disease within the blood to be tested and it is seen, it is 72, 36, no, it is 3 months. That is 90 days.
Yes.
So in those 90 days, you must have tested once. That's why we remove the double testing. The double testing. Now, why do we say in transmission we give you 72 hours? We have 72 hours in transmission if you have been in contact with HIV positive person. You understand?
Yes.
If you are not sure, you have tested today with your couple and your couple is positive, and you have had a sexual intercourse today, we give you PEP within 72 hours so that we prevent that for you from not to get that. But in the normal testing, you have tested you are HIV negative and your couple is also negative. We give you more 3 months for you to know what you should do again. You can go and test again before getting married to this person, because there is what we call window period. The window period I'm talking about is when you have tested HIV and I have tested HIV, but I have acquired HIV within less than 90 days and it has not been shown in blood. That window period, I may go with you today and you find within the course of being with you, you have got HIV. And I'm also positive and you're also positive. So that's why we always tell you that whatever you do it in a ratio. That if you have tested for 3 months, you are going to give more 3 months and check and be sure that your couple is negative or you are negative or is positive. Okay. Yeah. So it should be a period of 3 months. Don't just take one test and you say, it is all well, because you are not sure where the window period starts. Yes.
Okay. So I think for most of the conversation I've been talking about prevention. So I would want you to say something to someone who has had a positive test. What next? Like, what can they do because they have this for a lifetime. So what can they do to improve their life, to be able to try and live something near a normal life? Yeah.
Well, this is positive living. They are happy. Actually, we call them happy, positive living persons because they have known themselves. They have gone intensive counseling. They have gone a lot of tests. They have known themselves. They have seen other people who have lived with HIV for some many years. We have people who started, like at my doctor, we have people who started HIV positive whom we tested 2010. 2010 up to now, they are happily living. They have children. Those who had children, they still have them. And those ones who have had children after knowing they are positive, their children are negative. We have passed them through. We have 36 children who are born by positive mothers and positive fathers, but the children are negative. So that is a great chance that being positive is not the end of your life. There are very many people who have died with other illnesses, not HIV. And the good thing is that after knowing that you are HIV positive, you know that there is a treatment for it. There are those ones who know the disease they have, and they know that even if they take the medicine, they will not have the cure. For example, like the ones we discussed last week, someone knows that I have cancer of the cervix. If it is not to cut the cervix, to remove the uterus, even if they remove the uterus, still the cancer cells might have gone to another level. Others know I have cancer of the lungs. They will know that I have cancer of the lungs, I have no cure, I will be there, take preventive medicines, I'll be on oxygen, at the end of the day, I will die. Not even this person of HIV have died. So the good thing that we have is that we have the medicine, enough medicine for HIV, and there is a good adherence. If there is good adherence, there is good care and follow-up, then there is good nutrition, they happily live and you find when they are very okay with their positive living.
Okay. So lastly, as we come to the end, I would want you to talk to the ladies. Some ladies who are positive fear to get pregnant. They fear that they will transmit the virus to the child. So I would want you to like talk to them, tell them about the new interventions, the option B plus, and if they have the child, can they breastfeed? Up to what extent should they breastfeed? Yeah, something like that to the ladies.
Okay, I'm going to talk about that in this aspect, that most ladies, they lose hope after knowing they have been with multiple sexual patterns. When we take an example of CLADs, we have community groups where we go and find those people. For example, when we know that we have tested Nathan and is positive, but every evening is always at maybe Mastoa and is having booze with around 5 people and is having with 5 girls and 5 boys. Now, we take that group as an emergency group. We go to them. When you go to check those 10 people, you find that Nathan has already slept with 3 girls within the same group. And John has also slept with the same girls in the same group. You find even Frank has also slept with the same. So you find there is a chain of transmission. But when they know that they are HIV positive, now they know. I've been getting money for hair from Frank. I've been getting the one for nails from Nathan. Now this one from this. And now they have known that I'm HIV positive. They lose hope. After losing hope, they don't want to give birth. They decided to sell themselves because they want to spread the disease. It's not that they don't want to give birth, but they don't want to lose a figure. They don't want to be married. They don't want to be called mothers. They want to keep healthy and keep transmitting the infection, and they are there. But those ones who are faithful and they say, no, it is okay, I'm HIV positive, I live with it, they can take their medicine until the viral load is not detected. After knowing that the viral load is not detected, they can be able to get pregnant. Their children will be healthy, negative, and very okay without the disease, without the infection. If they trust the medical personnel, they trust the counselors, they abstain for 6 months, take their medicines. After 6 months, we shall take another sample from them. Then after 1 year, we take another sample from them. Then we see how is the viral load. After the viral load have shown not detected, they can get their partners they want, as long as they agree. After agreeing, then there is no problem. They will have pregnancy. We monitor them up to delivery. We give them treatment up to 18 months. Those children, we give them Septrin and Nivaparin for 18 months. After 18 months, they are declared free and they go home. No medicine. They are very happy living with them and they'll be happy.
Okay, thank you so much, Dr. Nathan. I am sure so many myths and misconceptions have been cleared in this episode about HIV, and I'm sure that we have learned a lot. So to our viewers, thank you so much for staying with us. Just to summarize the whole episode, we started with HIV and how you can prevent it. Please use condoms or abstain or be faithful to your partner if you have one. And we have also learned that the self-testing kits are not 100% accurate. So if you want an accurate diagnosis, please go to the hospital, listen to your doctors. We have learned about the window, the 3 months. Yeah, we are going to be having these episodes on this My Doctor podcast, occasionally talking about different issues. If you have an issue that you would want us to talk about or a doctor you'd want us to host, please feel free to comment in the comment section. Or if you're a health worker out there and you'd want to discuss some of these issues, please contact us. You can comment or you can contact us on the My Doctor platforms on all the social media pages. Yes. Thank you so much. My name is Mwesigwa Joy and this is the My Doctor podcast. Stay with us.
My Doctor, your health anytime, anywhere.